So I have my ordinary mobile phone. I go to the applications on the screen, open applications and select T plus diabetes in this case as someone with diabetes, and I connect up to the application, which you can see there is T plus diabetes, and then I'm ready to use the application together with my blood sugar meter in order to see how I'm getting on and think about what I should be doing next. So the first question that it asks me when I run the application is how long since I've eaten. In my case, I had breakfast just over 2 hours ago, so I scroll down to 2 to 4. That gets me to think about how long is it since I've last eaten. And then the next question asks me what my blood glucose reading is now. So at this point, I get out my blood glucose meter and I will take a reading. Okay, so I've got my blood sugar meter. I've put my little strip here into my meter, and I now need to prick my finger to get a drop of blood on the little test strip. Having pricked my finger, I apply the drop of blood to the test strip, and it takes about 5 seconds, as you can see, to read, and my blood sugar is 4.9, slightly low but quite normal. So the reading is 4.9 millimoles per liter. I remove the test strip, I press the Bluetooth cradle, so as you can see the meter is sitting in this little cradle here, which is a Bluetooth transmitter that connects it directly to my mobile phone. And as you'll see, the mobile phone picks up the reading and it will then transmit it to my webpage for the nurse to have access to it if she needs to. So it's picking it up from the Bluetooth, and as you can see, it's got it from the Bluetooth meter. The reading is 4.9 millimoles per liter, 9:48 this morning. So the reading was transmitted directly from my blood glucose meter via the Bluetooth cradle that I showed you, appears on the screen, and it's now loaded into my phone. So I've got it in the phone, I go to the next button on the application, and it asks me to enter my blood pressure if I have a high blood pressure. In my case I don't, so I just skip this. It asks me about how much exercise I'm going to do. Well, I'm sitting here doing this, and I know that I'm going to be at work all day, so probably less than usual. It asks me to enter my weight if I need to. It hasn't changed, so I just go straight to next. And here we have on the screen now all my recent readings from the last 5 days. I proceed to the next, and of course it reminds me at the top that my blood glucose reading was 4.9, and I can now think about how much insulin to take. Well, that's quite low, so I'll only take 10 units. So I enter 10 units. It is short acting. I select that, and that's it. So what this has given me is a screen that's allowed me to manage my diabetes this morning by taking the appropriate insulin dose, and at the end I get a summary. I was in the green, that's fine, so a little black arrow shows me being in the green. It shows me my last blood glucose reading as 4.9 as we see. My average over the last few days, 7.3, also tells me my blood pressure when I take it and so on. So that shows me how I've been getting on over the last few weeks. I've been mostly in the green with the occasional higher readings here in the red, and occasionally I've gone a bit too low, which is the blue. So this is a good summary as I finish using the application, telling me how I'm getting on. And if I was spending too much time in the red or the blue, I would probably get a call from my nurse, because all the information that is stored on my phone is also stored on the web page, which my nurse has access to. And if I do get into trouble by spending too much time in the red or the blue for having low blood sugars, then the nurse will phone me on this very mobile phone, and I can get help and advice on how to try and do a little bit better in the management of my diabetes. So as I say, this is something which is being used by hundreds and in fact thousands now of people up and down the country to manage diabetes. And what we're now going to be doing with our Oxford collaborators under this new funding is add a little bit more to this diary that you saw on the screen about food intake. Okay, so now we're in the nurse's office. It's 10 10:06 on the same day, as you can see, and the nurse is reviewing my data here as a patient. And what she has on the screen here is my blood glucose readings for the last 7 days. So it says the last 7 days, glucose trend, and here on the screen you can see all my readings. The green readings is when I'm in control. Red reading here is when I was out of control. My blood sugars were a little bit too high, and here there was a blue reading showing that my blood sugars were a bit too low. Additionally, you can see this grey area here. That was last weekend. I wasn't very good last weekend. I didn't do any readings, but in fact, because this is all live and real time, we can zoom in on the last reading, which is down here with a little arrow. And as you can see, that's the reading that I did just a few minutes ago, 4.9 millimoles per litre, if you remember, which was normal, therefore in the green, and it was 9:48. So about a quarter of an hour ago. And the phone transmitted all that information automatically to the website, without the person with diabetes, myself in this case, having to do anything, because it's all done automatically. So you have self-management on the phone for the person with diabetes. You have patient management here by the nurse, who's alerted if somebody is spending too much time in the red or the green automatically. She can get an email, she can get a text message. And the other thing is 24/7 coverage, because if you go to the top of the screen, one can see that we are working with NHS Direct as well. So all of this technology is being rolled out across the NHS. We're working with 1 or 2 primary care trusts at the beginning, but hoping to go nationwide, and therefore working with NHS Direct to provide 24/7 cover for the people with these long-term conditions who may have an incident, say at the weekend, where their community nurse may not be working.